Hi, my name is Giselle Rivera and I will be introducing the bone video on the axial skeleton. First, we're going to go over the cranial bones, and so here I have my little skeleton. The first one is the frontal, which is the front. Here we have one bone of the cranial bone. Second, we have the parietal, which are the two sides here. There's two of those. And then on the back, we have the occipital, which is one. On the occipital here, this is used as a landmark, and you'll see the little dot here when EGGR records. Also, this is where the nuchal ligament and the trapezius muscle attach. On the I'm missing the temporal bones, which are the sides here, temporals, there's two. And then I will be doing the external view of the temporomandibular joint, which is between the mandible and the temporal joint. Next is the external view, which is the mastoid process here at the tip. Then we have the styloid process right under. We have the external acoustic mediatus, which is this dot right here before the zygomatic arch. And then we have the squamous part, which is right here, right by the squamous temporal occipital here. Internal view of the structures that I will be talking about are the, under here is the petrous part of the temporal bone. And this is located between the sphenoid and occipital bones, right in there. I will make a dot with my pen. Don't know if you can see it, but the internal acoustic mediatus is also in there, and it's part of it. The internal acoustic mediatus is the vestibular cochlear, the facial, and the labyrinth artery from inside the skull is what passes through there. Next, I will be presenting the sphenoid. Part of the sphenoid, which is the external view, it's the lateral and orbital part of the greater wing, and you can see that through the eye. I will get a little red dot inside the eye. If you can see that, that is the superior orbital fissure. And that is the lacrimal and frontal and nasociliary that passes through that opening. Internal view of that would be this. It looks like a butterfly. And that is called the, like the greater part of it here. If you see it, this is like the body of the butterfly, and these are the wings. The outer wings are called greater wings. And then the inner, which are the smaller portion of the wings, which would be inside, would be the lesser wings. The optic canal is located, it's really hard to locate it here, but we know that the optic nerve and the ophthalmic artery pass through there. That would be here towards the back. The sella turcica. The sella turcica is this part right here in the middle of the butterfly. So these are the wings. And then this is the sella turcica, which is like the body of the butterfly. That structure sits on the hypophyseal fossa, and it contains the pituitary gland on the inside of the head. For me, it's easy to recognize this, like I said, for it being the body of the butterfly. Next, I will go over and present the crista galli, which is the bottom portion here, which is like the back. If you see, it's like I wouldn't say like the forehead, inside the forehead. This little thing, it looks kind of like the Crista gallo, Mexican, Hispanic, so I know, but it's kind of like a rooster, like the top head of the rooster. That holds the olfactory bulbs, this right here, holds the olfactory bulbs and the olfactory nerve on the sides of it. So this is the sella turcica, the crista galli, and so the nerves sit on the side of it. And then the cribriform plate, that supports the olfactory bulb. And those are the little dots that I drawn around the crista galli here. They're little dots that sit there around it. And this one sits between the anterior cranial fossa and the nasal cavity. Next, I will be presenting the sutures on the head. And the first one we have is the coronal, which is the top one here. That one unites the frontal and the parietal lobes together. Then we have the sagittal up here, which connects or unites both parietal lobes. And then we have the lambdoid, which unites two parietal lobes and one occipital, which is back here, and you can see it here kind of going across. And then we have the squamous, which is, I'm trying to see where we can see it a little more clear, but I would say probably here on the side, on this area here, that suture there. It unites the squamous portion of the temporal bone and two parietal bones. Next, I will be presenting the facial bones. The first one, let me see here, let me get it together. So the first one I will be presenting is the maxilla, and the maxilla is this one here and the one right by the teeth. So the maxilla is part of, put up the camera so they can see me. Maxilla is this right here, this portion here. And then part of the, I want to say the gums, that's what the alveolar process is, the gum, like right before the teeth begins. Back to the structure here, I'm going to use my colored pencils to kind of dot what I'm talking about. So with blue, I will do the nasal bone, which is the top portion of the, it's right on top of the vomer, I want to say, but it's blue here. And then the zygomatic, which are the sides here, this right here. Do you want to bring the camera down to the skeleton so that I can, this right here is zygomatic. And then we have the ethmoid, which is inside the nose, the ethmoid bone. The vomer. The vomer is asking like what two bones from the bony nasal septum makes these up, and it's the vomer and the perpendicular plate, and that's like the perpendicular plate right inside the nose. And then we have the inferior nasal concha, and the inferior nasal concha is asking what does this bone do? So it is a turbinate to the nose. So it is to the right of the vomer, so it's inside the nose. Onto the right here somewhere inside the nose, but I really just can't reach it, but it's right inside and I'm making a dot with it in green. I hope you can see it. Onto the mandible, I will be describing the mandible here, which is this part here. So we have the ramus, which is this part of the mandible on the side. This is the ramus. Then we have the angle, which is here somewhere. And then we have the body, which is this here. And then the mandibular condyle. Mandibular condyle is up here, up at the top. And then the mandibular notch is the U here in between. And then the choroid process is this other side here, the opposite of the mandibular condyle. So this part here. Next, I will be presenting the vertebral column. Thank you. Hi, so next I will be continuing my presentation with the vertebral column, and that is the cervical, the thoracic, the lumbar, the sacrum, and the coccyx at the bottom. But I believe the coccyx is not part of the vertebral column since it's just sacral. The two primary vertebrae, or the curves I should say, are the thoracic, which are these up here, and the sacral. Those are the first ones that we developed as babies. The secondary curves are the cervical, which are the ones on the neck. Whoops, this is moving a little bit. The cervical and the lumbar here. On the cervical vertebrae, we have 7 vertebrae, and that they are called the C1 through the C7. So 1, 2, 3, 4, 5, 6, 7. So these first ones here are composed of their cervical vertebrae. And the atlas, it's a faucet that articulates with rounded condyles, allowing them for motion. So these allows for our head to do this type of motion, up and down. The unique thing about the transfer processes for all cervical vertebrae is the transfer foramina, the bifid spinous process, and overlapping vertebrae of the body. The thoracic vertebrae that we're going to be talking about, which are these here, there's 12 of them, those will be the spinous processes. So on these here, I noticed on the PowerPoint videos that I was watching, this, I think these were compared to a I forgot the name of the animal, sorry. But these were compared to another animal. Anyhow, so this were compared to a hippo, I think, and then these were compared to a giraffe for the look of the nose and the ears. So that's how I memorized the thoracic as a giraffe bones, and then these are the hippo, the lumbar. Anyway, so the spinous processes is like the middle, which is the nose of the giraffe. And then the transfer processes are on the sides, which are the ears. The intervertebral foramen, the root of each spinal nerve, the spinal artery, segmental artery, communicating veins, internal and external plexus, meningeal nerves, and transformational ligaments pass through here. And a good way to show you that is I'm going to pull the vertebrae apart, and you're going to be able to see the silver tube. If you can see that, can you do a close-up? Here, let me get my pen and lift this. So wherever you see the silver, sorry, it's hard. Wherever you see the silver, that's where all the bones and ligaments and all that stuff that connects to the vertebrae would pass through. Next, I will be going over the body or centrum, which is this here, the body or centrum of the spinal, of the thoracic vertebrae. And then the position of the intervertebral disc, those are these little fine lines that you see going across. So you see the bone here, the body, and then these are the intervertebral disc into each one of the vertebrae. For the lumbar vertebrae, which are these down here, the hippo look-alike, those consist of 5. We have a total, it's a total of, I want to say 9 together with the sacrum and the coccyx. So we have 5 fused sacral vertebrae, and then we have 4 fused of the coccyx here. Coccyx here and sacral here, and then these are the lumbar. For the next following presentation I will be doing, it will be on the sternum, and I will be going to the front body of the of my skeleton here. So this is the sternum, which holds our ribs together, coming together at the front of our body. The top portion is called the jugular notch, and then followed we have the manubrium, which is the second part of the body here. And then thirdly, we have the xiphoid process, which is down here. It's the bottom portion of the sternum. And then the middle portion in blue is the body. So again, the green is the manubrium, the blue is the body, the yellow is the xiphoid process, and the red is the jugular notch. Moving on to the ribs, I have the first 7 ribs, which is 1, 2, 3, 4, 5, 6, 7. The first 7 ribs here are what they call true ribs. and then false ribs